Well, how's this for a medical mystery? There's a serious blood disorder that you may suffer from, and it's not uncommon at all. In fact, it's not even a mystery to blood specialists. What is a mystery is diagnosing it. And here to help us create awareness this morning about this condition is hematologist Dr. Doris Quon from Los Angeles. Good morning, doctor.
Good morning.
Thank you so much for coming this morning. Let's talk about this. What is it called and what exactly is it?
It's called von Willebrand disease.
Von Willebrand disease. I've never heard of it.
It is a bleeding disorder that people are born with it, and it affects actually a lot more people than you would think. The milder forms can affect up to 1 in 100. The more severe forms up to maybe 1 in 10,000. Again, it's a bleeding disorder that you're born with. It affects both men and women equally. And it's due to a deficiency in a factor called von Willebrand Factor, which is in your blood. And this von Willebrand Factor helps stop bleeding. It helps blood to clot. So when you cut yourself, you use the von Willebrand Factor it's a glue-like material, and it helps you to stop bleeding.
So what's the difference, let's say, from this disorder, doctor, and hemophilia?
Well, hemophilia is actually more commonly known because it's been called the royal disease because it was in Queen Victoria's family.
That's right.
And so von Willebrand disease was actually, when it was first discovered by Dr. Erich von Willebrand, it's named after him, he termed it actually pseudo-hemophilia because it was found both in men and women, whereas hemophilia, the disease affects mostly men.
So doctor, do people with this disorder bleed uncontrollably like people with hemophilia?
They bleed similarly, but it's not uncontrollably. They bleed longer. They may initially stop bleeding, but then the glue-like material is not there, so it just starts bleeding again. And so you get this phenomenon of bleeding longer. Initially it may stop, but then you have bleeding again, and it's very difficult to control the bleeding if you have trauma or if you have surgery. Some of the common bleeding symptoms that you might see, especially in children, are things like nosebleeds or gum bleeding. After loss of a tooth or dental extraction, you may have extended bleeding. In women, when they start their periods, they may have uncontrollable bleeding. And so that's termed menorrhagia, and many women have very heavy menses. It's very common.
And you and I were talking about this a few minutes ago before we started our interview here, and you were telling me it could take up to maybe 10, 15 years to diagnose this. Why so much time?
Because it's actually, people don't think about it. It's a common bleeding disorder, but people don't think that, oh, the nosebleeds are from a bleeding disorder. They may think it's from trauma to the nose. Heavy menses, there's so many reasons why women may have heavy periods, and so people don't think, well, the menses are actually from a bleeding disorder. So that's one reason that they just don't think about it being a diagnosis. The other thing is that it's actually difficult to make the diagnosis of von Willebrand disease. The labs that are used to make this diagnosis are not common, so a regular lab may not be able to order it and get it done properly because special tubes have to be processed certain ways. So there are a number of factors, and von Willebrand Factor itself is affected by so many different things such as stress, hormone levels, exercise, activity. So you're trying to diagnose a child maybe with von Willebrand disease, and we all know children when they're trying to get their blood draw are screaming and kicking.
Sure.
Right,
very difficult.
So that will make your von Willebrand levels rise.
And does this make this disorder, let's say, more dangerous than hemophilia?
It's not necessarily more dangerous than hemophilia, but again, if somebody hasn't been actually diagnosed formally, they may have a lot of bleeding after surgery, and that can be very dangerous if it's not treated properly.
Excellent information. Doctor, stay right there because we're going to bring in a patient in just a couple of minutes. When we come back, we're going to speak to a patient who's doing so much to create an awareness of this disorder, and we're also going to talk about treatment options. So stay right there. We'll be right back. Welcome back to the Balancing Act. We're joined once again by hematologist Dr. Doris Quon, and also we're joined by Darcy Zweier. She is a patient advocate for women with bleeding disorders. Welcome, Darcy.
Thank you.
Thank you for being here. Darcy, let's talk about what you do. I understand, many women have bleeding disorders. You're a patient advocate. Their lives really change dramatically. Tell me about that.
Before diagnosis, a woman's quality of life is compromised. She's unable to lead a normal life, I believe, because of heavy menstrual bleeding. A lot of the women that I talk to stay home because it's
so hard to leave the home.
It is. It's it can be embarrassing. I know I missed out on a lot in my children's lives because I wasn't willing to leave and to go. And I did stay home until diagnosis.
And that's really hard because you
It's
want to go to
terrible.
their events. I go to my daughter's dance competitions all the time. And like you and many other women, you stay home just within four walls.
Right.
Dr. Quon, she mentioned diagnosis and treatment. Let's talk about that.
So von Willebrand disease can be treated. There are treatments out there. The first type of treatment can be given to patients with mild von Willebrands, not severe. That increases the person's own levels to, quote, more normal levels, and then the bleeding can stop. There are other treatments for more severe disease or more serious bleeding, and these are products that actually contain von Willebrand Factor. There are several products out in the market, and the FDA has approved 3 different products in the United States for treatment, and they can be given intravenously.
So there is hope.
There's good treatments out there.
Good
You just have to make the diagnosis.
Exactly, which is so important because, like we said, it can take so many years. Darcy, I understand you also founded a website. I love the name, findthe2%.com. Tell me about that and how the name came about.
Well, the name came about because up to 2% of the population has von Willebrand disease. And so we want to find that 2%. And the website offers information about getting a diagnosis, about the signs and symptoms, and there's some great information there to take along to the doctor with you to get that diagnosis.
I love it all, creating awareness. And Dr. Quon, any final thoughts?
Well, diagnosis is very important. So if you think you have a bleeding disorder, you should go and talk to your doctor about it and pursue the diagnosis. And if you get diagnosed, then you can get treated properly.
And know that there is treatment, there is hope.
Yes, there is.
Thank you so much, Dr. Quon.
Thank you.
Darcy, for information on bleeding disorders or anything related to what we're talking about today, where can our viewers go?
Findthe2%.com.
Findthe2%.com. I love that name. Thank you so much, ladies. God bless you. Thank you for everything you do. And if you'd like more information on what we've been talking about this morning, just go to our website as well, thebalancingact.com. That's thebalancingact.com. We love to share our segments with you there as well. Also, we are on Facebook and Twitter, so check us out there as well.